Part 11 of what went wrong with the coronavirus and management of the epidemic. Now, during the spring and summer of 2021, South Koreans were looking with envy at what was happening in other industrialized countries. There just weren't enough vaccines in South Korea. Now, the reason for that wasn't money. It was because the South Korean government was slow to make reservations, and it was South Korea was sort of lower down on the list of countries that could get access to sort of these brand name vaccines. But what also happened in South Korea was the government signed a contract with Astra-Zeneca to build a factory here and start manufacturing AZ, as it's called here, vaccines. And that unfortunately backfired a little bit because, again, this whole issue of vaccine hesitancy and so forth, although it's much more mild here in Asia than it is in Western countries, did become a factor. And there were a few cases, a very, very small number of cases, of people having adverse reactions to that particular vaccine, and in particular, there were a couple of cases of death. Now, with these deaths that happen, what often is the case is that there are cofactors, there are comorbidities that sort of make a particular patient more susceptible to problems. And then there were issues surrounding the nature of the side effects, and these happen with other vaccines too. For example, enlarged hearts and so forth, very strong sort of immune reactions where people get a fever and experience pain and sweating after they have the vaccine. Those became issues too here in South Korea. But finally, the vaccination started to take off and get going.